So here's what we've done. Here's our track record. This is a case study where we've had 9 hospital health system. We have been in service with them for 6 years, 3,600 acute care beds, they placed prior to us 8,400 PICs and midlines, and they were reporting eclampsia one every 17 days. When they decided to trial NursePro as an outsourced company, and been there for 6 years. Here's what we found. We standardized their supplies system wide. We found across their system they had about 14 different types of dressing changes for the same medical device. Now they have two, one for central lines and midlines, and one for ports. We initiated a PIC audit program because so many times your vascular access programs focus on insertion, not care and maintenance, to see, okay, well, what's going on after we leave the bedside. And that really was very highlighting as to some of the breaks and where we need to focus our education. Never punitive, but we just want to show, okay, where do we need to focus our education? And the PIC audit program really highlighted that. And it's an ongoing, everyday kind of thing. We made 14 FTEs made available to put back into the system, especially now where you have, nursing is such short. We're able to free up those nurses who are typically a wealth of knowledge and be able to put back them in their specialty units. We created a nurse residency education program. All new nurses that have just graduated, they come to me for 4 hours. I get them 2 hours to teach them care maintenance of all central lines, and then I teach them 2 hours on how to start an IV. Now, that seems counterintuitive from a business standpoint, but we want to emphasize the patients need the right line at the right time. If they need an IV, they need to get an IV. They don't need a midline. They don't need a PIC line. We need to educate and make our nurses at the bedside so much stronger and more confident. So part of that nursing residency program is that. Also, we've created and continually create the ultrasound PIV programs. So the more senior nurses that you have, they send them to me, and we do an ultrasound IV program, and then competency goes from after that. We standardize their policy and procedures system wide. We had a 10%, as a result of all this, we had a 10% line reduction rate across. Of that 8,400, we lost 10% of those, which was the right thing to do. 0 reported eclampsies for the first 12 months at these facilities, which was a significant outcome.